My grandfather, who I was very close with, he built houses, and my dad did also in his spare time, and so I grew up in the construction world. Spent a lot of time with hammers, nails, saws, drills, and I was heavily involved in sports too. I played a lot of sports, love sports, still enjoy playing basketball and golf. So I always thought I'd go into orthopedics. You know, you could combine power tools and sports together. But then when I got into my training, I loved orthopedics. It's a great specialty, but I kind of gravitated towards general surgery. But in my residency out in Pennsylvania, they started a breast center when I was there. And I really got to know the breast surgeons, and I spent a lot of times in their cases and with their breast cancer patients. And I really enjoyed that, so I kind of gravitated toward breast surgery, and here I am. You know, I grew up in a really medical family. My dad was a paramedic with Sioux Falls Ambulance and then Rural Metro, and he spent a lot of times at the hospital in the ER here. And my mom is a labor and delivery nurse here at Sanford. She's been doing that for many years. And then I have one sister, and she's an ICU nurse here at the hospital also. I'm part of a general surgery group called Surgical Associates, but Dr. Paula Denovan and I, we do all the breast surgery, so there's basically two of us. And Dr. Denovan's a great surgeon. She sees a lot of breast cancer patients, and then I see quite a few too, so it's basically the two of us. I'm very blessed here in Sioux Falls. You know, I got some very talented plastic surgeons that offer some really nice reconstructive options. There's only 5 fellowship-trained breast radiologists in the whole region, and they're all here at Sanford and Sioux Falls, so we have really good radiologists. So we tend to draw a lot of patients in from far away. I think my goals, you know, the first time I meet with a patient is 2 things. One, I want to educate them. You know, what is your diagnosis? What does it mean? And then second, you know, I do want to give them hope. I really do. I'm very honest with my patients. I never give them false hope. But I want to be positive with them and let them know that this is a doable thing. You know, the great majority of the time, this is treatable, this is curable. We got a great team. We're going to take great care of you. We do this all the time. And you're in good hands. So those are kind of the 2 main things that I want to portray to the patient with that first visit. I'm very blessed to have very nice patients. We live in South Dakota. There's something called South Dakota Nice, and it's true. Patients are great. Their families are great. So I deal with some really nice patients and families. And I'm also blessed to be surrounded by a really good team. I have an amazing physician assistant. I have an amazing nurse. I got great nurse navigators. My nurse navigators spend a lot of time with me and my patients, and they follow them around. I got a great OR staff, great cancer staff. So we have some really talented people that make me look a lot better than I am. So I'm very thankful for them. We care not only about the patient as a name and a medical chart number and a diagnosis, but we care about that patient as a person. And I think that really shows through our care and our team and the way we approach breast cancer.